What legacy do you leave for the new generation?
I hope that I have been able to make all the mistakes. And by making the mistakes and correcting the mistakes, then my goal and my desire is to teach you so you do not make the same mistakes I made. You know, that's how we grow. In generations of families, we would like to think that every generation gets better than the last generation. If that doesn't happen, then the world will never get better. If we just keep repeating the same mistakes politically, in the world, we tend to do that. But in orthodontics, in our little bitty part of the world, we have progressed very well. And during my 40 years of orthodontics, it's amazing to think how things have changed. When I started practice, I put a band around each tooth, all the way around, upper and lower. I did that for the first 10 years I was in practice. And then we had preformed bands, and then finally we learned how to bond. And when you start bonding, it changed everything. And then the NiTi wires, the super elastic wires and heat activated wires and things like that. All of those things make our work easier. Maybe not easier, what's a better word for that? Maybe it's just more, it's faster. But it's also been said that the more things change, the more they stay the same. Because I go back and look at the very first cases that I treated, and 40 years ago, and I diagnose those cases today. The biggest change for me is that I do not extract teeth like I was, because I was trained in the Tweed technique, and it's an extraction technique. And so today, I would not take out so many teeth as I did back when I first started practice. But other than that, the principles of where the teeth should be, IMPA, keeping the lower incisors upright, creating a class 1 occlusion, good interincisal angle, those things that we preach today, excuse me, were just as important then. And that hasn't changed. What bothers me about what's happening in orthodontics today is that some people tend to try to change the rules. Well, there are certain rules that are stable and they're never going to change. Now, if you want to ignore the rules, that's your decision. But if you learn how to follow the rules, then the good thing about orthodontics today, like in our practice, where we used to have to see a patient every 3 or 4 weeks because all we had were stainless steel arch wires. Now we can accomplish the very same thing by seeing the patient every 8 weeks, 6 or 8 weeks. So as a result of that, where I used to see 75 to 100 patients per day, you should have visited me 15 years ago when I was really rocking and rolling. And we had a huge staff and patients everywhere. And that's just the way it was. Today, my son Moody sees the same patients, but he sees them every 6 or 8 weeks. So that means actually he can double his capacity. And if he wanted to work as hard as I did, he would end up seeing twice as many patients and treating twice as many patients. But I think what he's chosen to do is just not see quite as many patients. But and so his practice is, not quite the aggressive practice that I did when I was young. But the quality of treatment, and I'm so proud to see not only Moody, Dr. Moody, but Chuck, my other son, and members of our study club. And I'm looking forward to, in the future, coming to Bulgaria and seeing you present your cases to me, and so I can grade them and look at them and help teach you. And all I want to do is teach you things that I have learned. And these are the basic fundamental foundations of orthodontics. The bracket system, of course I'm very prejudiced there because I have designed the bracket system so that it will achieve those goals that I've set for it. Obviously my technique is not the only technique that can do it. However, there is no technique in the history of orthodontics that has the proof that I have with our room of truth and all the models and all the x-rays and all of the diagnostic records on over 10,000 patients. And we continue to do research. We've just had somebody call us from the University of Texas at Arlington, my university just right down the street here. An anthropologist is going to come over and do work in the room of truth and studying cuspid eruption in human beings. It has nothing to do with orthodontics, but to me that's exciting to really expand and broaden the use of that technique and the use of the room of truth. So that's probably, as far as legacy and me leaving things to you, when it comes right down to it, I think the room of truth is probably the biggest legacy I'll be leaving, because that's a lifetime of work, experience, mistakes, achievements, goals reached, goals not reached, but it's the truth. And that's what I want. I want you to know the truth. And I'm hopeful that by us continuing to work together and continuing our efforts, that you and your patients will benefit. Because really, what's the bottom line to everything? And that is, when you sit down in the chair and you have this little patient in front of you, you are responsible for making decisions that will affect that child's entire life. If you make the wrong decisions, it's going to hurt that patient. If you make the right decision, it's going to really be an asset and a positive factor in that patient's life. And that's what we are about as orthodontists. And so, remember that. And see, the other thing about it is we're not in a hospital, are we? Every orthodontist, his office is his hospital. There's nobody else looking over your shoulder. You are making the decision as to what to do for that patient. Now, if all you want is money, then you can say, well, that's not as good as it should be, but it's okay. Send that patient out, bring another patient in, and I'll do this. And you can make a lot of money in orthodontics, no question about that. But I have found that you can do it right, or do it as close to perfect as possible, and still make a lot of money. I spend a lot of money on the room of truth, taking records, the time and the effort, and all of the things that it's taken to do that, and the cost of storage of these and everything. This all takes money, but to me, it's again my gift to orthodontics. And in spite of that, I have still made a lot of money in orthodontics, and I'm not ashamed of that. I'm very proud of it. But I think I've earned my money. I think I have earned it by giving my patients the very finest quality treatment that I can do. And that's my challenge to you. And because that is your responsibility to give it your very best effort. And when you do, you will find that you will receive the beautiful results. Thank you very much.
Thank you, Professor.